Good afternoon, everyone. I'm Governor John Carney. Thank you for joining us this afternoon. This is our twice weekly press conference on Delaware's response to COVID-19. We've been doing these press conferences now for over 2 months as we've tried to communicate with folks up and down our state about the situation on the ground with the COVID-19 pandemic. In the last couple of weeks, our last 2 weeks, we've also talked about the situation in each of our cities and towns and small areas across our state in response to the George Floyd murder in Minneapolis. And I'm pleased to report that the protests that we've had so far, and there's close to 20 of them, I would say, have been peaceful. They've been respectful, and we've had a couple that just two, one in Dover, one in Wilmington, that got out of hand, but by and large, they've been peaceful protests. I want to thank everybody involved. I want to thank in particular local law enforcement, which takes the lead at each of the events, whether it's the City of Dover, Georgetown PD, Seaford PD, Rehoboth, whether it's the City of Wilmington here with the backup of the Delaware State Police, and that partnership is really important and one that's proven successful. What's been most impressive, particularly when with the issues at hand with respect to police brutality in communities of color, is I think the respect and restraint that's been shown by local police and Delaware State Police, and in particular in way some of the protests have ended. One in Dover where Colonel Nate McQueen took the bullhorn and talked to the protesters about their right to protest and encouraged them and convinced them that it was time to go home, and they kind of embraced him and did the same. In the way the protests ended on last Friday night with Chief Tracy walking with the leaders of the protesters that were left there at about 10 o'clock, 10:30 at night, and they walked for 8 minutes and 47 seconds and then embraced and dispersed. And that's the way it's supposed to happen, and that's the way you hope for and pray for it's happening. And one of the things that our activity last week kind of underscored is, for me as your governor, is not just talk, but in action, and I know there'll be a time for that in the days ahead, and we're certainly interested in working with all men and women of good faith to do that here in our state of Delaware. I start the week with a call to the mayors in the small towns across our state, as I said, and this morning we talked about the protests, and we also talked about the conditions with respect to COVID-19 in each of those jurisdictions, and started off with the beach towns to get a report about conditions on the beaches and the boardwalks and in our beach communities, and just got a very positive report from the mayors in the coastal towns, Mayor Becker in Lewis, Mayor Coons in Rehoboth and Bethany Beach as well, in terms of social distancing on the beach, in terms of social distancing and mask wearing, importantly, on the boardwalks, which is one of the, I think, the real test for all of us as the conditions on the ground continue to improve in terms of the spread of the virus, is continuing attention to protections and mask wearing and social distancing. And it's easy to let your guard down, but our message still has to be strong. I mean, there's been a high cost for all of this in terms of the broader shutdowns in our economy and the stay-at-home orders and the out-of-state quarantine, travel quarantine. Now's not the time to let all that go to waste, all that good work. We'll have some slides in a minute to show how the traffic across our state was affected positively from an isolation point of view and from the effect on the spread of the virus. We also have some slides that show, the curve, I think that's almost like the academic curve for a virus, and it's very steep incline and decline, and we'll see that in some of the. So we're reminded that as we talk to you today on June the 9th, and we're several months into this, that the phase that we're in now involves intense testing, and so we would bring everybody's attention to the testing page on our website. We have testing going on today at the Townsend Fire Company from 10 to 2, so it's almost completed. Then tomorrow, by appointment at Beebe Hospital, Sussex County Bay Health at Dover Downs, and at the Sussex County campus. First Aid Community Action in Georgetown from 10 to 2. And then here in Newcastle County, Stanton Middle School from 10 to 2. Leisure Elementary School from 10 to 2. And we have all told 9 testing sites between now and Saturday, and would encourage everyone, whether you have symptoms or not, to get tested. It's the way we're going to track the spread and contain the spread here as we open the economy again and allow people to circulate more. We know that's going to create risks, and this whole testing, contact tracing, and isolating is the way we're going to manage that risk going forward. So we need your cooperation and your help with respect to paying attention to wearing a mask in public, and particularly if you're in a retail establishment, to protect yourselves and others, mostly others, and to respect their health and yours as well. And so face covering is important. Social distancing continues to be important. We're addressing, we've heard from a lot of folks from businesses who are standing up again, and I've been around to a lot of the restaurants here in Wilmington and in other places in our state to see the protections that folks are taking, very creative and thoughtful. There's the success that will depend on customers coming back to the restaurants, and so it's important to continue to show and demonstrate the protections with mask wearing and social distancing and all those restrictions and guidance that's important. And that's in everything that we do. The new normal is different than the old normal, and that's going to be the way that we protect one another going forward. One of the more challenging, we should have known this, one of the more biggest challenges that we've had going forward is the restrictions and guidance around youth sports. If there's anything that gets emotions flowing, it's youth sports. If you haven't been to a youth football, field hockey, basketball, lacrosse, you name it, game where children involved and parents and grandparents are in the stands, you haven't seen raw emotion. And so we've heard from a lot of parents and coaches, rightly so. It really, as a lifelong sports enthusiast, I played 4 sports growing up: baseball, track, basketball, and football. 3 sports in high school: basketball, track, and football, and 2 sports in college: football and lacrosse, and 2 sports as an adult: basketball and lacrosse. And so I know how important it is to individuals just in terms of their self-concept and their physical health, but how important it is just to our way of life. In my household, what's mostly on the TV is sports. We are enjoying the 2008 Phillies championship run as is being televised the last several days, and it really is good to tune into Philadelphia sports when you know that the Philadelphia team is going to win. They're smart enough to televise all the winning games and leave those disappointing games behind, and that has been one of the positive things, if there is one, through this whole pandemic. But sports for our children is really just so important. It's the way we stay close to our children. It's the way we enjoy their progress through life, and it's the way we kind of enjoy our life. And so there's a lot of emotion wrapped up into it. Some of the guidance that I've seen makes my head spin to think about how it works when the catcher's that much further away from the batter than it was when I was catching and pitching in Little League all those years ago. But the reality is, again, the virus is still out there. Yes, it's true, children have not been getting the virus, or at least have not been symptomatic and getting tested positive at rates like adults. In fact, I was looking again at the numbers last night. We're still about 6% or less for children under the age of 18. But we worry about them carrying the virus to their grandmothers and grandfathers, and that's the biggest concern. So my patience has been tested through all this, and certainly tested recently, like I know all of you, with respect to the guidance around the sports rules. And I'm going to blame the two people on either of my sides. Dr. Karyl Rattay, who's a sports enthusiast herself with children in youth sports, and Damian, DeStefano, who have been trying to balance out these objectives in a very difficult way. So let's run through the numbers quickly first. We're up over 10,000 positive cases. By the way, we have quite a number of tests. We're down to 108 current hospitalizations. Sadly, over 400 in total deaths. And again, those concentrated in our most vulnerable populations, again, underscoring our need to really lean into nursing homes and protecting our senior citizens. So 4,100 positive cases in Newcastle County. In Kent County, 1,500, pretty steady there in Kent County, and 4,300 in Sussex County. Still the most intense testing is taking place in Sussex County in the poultry plants. I think we're finished up with testing in the plants, and we've tested thousands of poultry workers and their families and neighbors in those communities across Sussex County, and continue to do so. And I think, again, it's one of the more notable parts of our response to COVID-19 here in Delaware. You can see, again, the infants to 4-year-olds, very few cases. 5 to 17-year-olds, as a percentage of the overall cases together, that's only like 6%. And then mostly middle-aged Delawareans and our senior population. So here's the data dashboard again. All the indicators are looking good, particularly current hospitalizations. It's probably going to start flattening out. I don't say that with any medical expertise, but the numbers are so low now. It's I guess hard to imagine it continuing to go down, but that's our hope. New hospitalizations each day. You see a little uptick there. Percentage of persons who tested positive, since we're testing so much more, we're looking at that again, and a little bit of an increase and then a decline. And I think the more and more we test asymptomatic Delawareans, we'll see that number continue to go down. On the bottom line, new positive cases, again, tends to be up and down just based on the irregularity of testing and testing results, although the testing results are coming more frequently, I think, than they were 2 months ago, when we could wait as long as 10 days for tests to come back from the private labs. Your kind of textbook graph there in the bottom middle of the increase in symptoms for flu-like symptoms and COVID-19, you'll see this in our look back over the months, and then the cases, cumulative cases, you can see is flattening out. All the vessels are full, the glass is full on all of our personal protective equipment, which is a good thing. I mentioned the testing locations. Pay attention to that, de.gov/coronavirus. You don't have to be symptomatic to attend. We have them going on tomorrow, as I said, at Leisure Elementary, Stanton Middle School, First Day Community Action, Bay Health, and BB by appointment. And so we're into the reopening. We started with the rolling reopening on May the 8th, and a lot of different business sectors allowed to open. June 1st, officially phase 1, and we're talking now about June 15th. It's just a week away now in phase 2, moving through this very quickly and again, gradually turning the lights on as we ramp up. I can't say enough about Secretary Jeff Bullock at the Department of State. He and his team, Director of Small Business Damian DeStefano, has been doing an extraordinary job. Very difficult job. It's tested his patience, I'm sure. I only hear from half the number of people, and I hear from a lot of folks about the challenges of opening businesses. When we shut them down, we weren't doing it fast enough. As we're opening them, we haven't been doing it fast enough. And so it's been a challenge, and Damian has really worked hard with public health to make sure that the principles of a pandemic, of a infectious disease spreading like it does, and how it does that to protect as people circulate in public places. And Damian, we thank you for being with us today. We have Dr. Carl Rattay, who's usually here sitting with us, Director of Public Health, and her team doing a great job as well. So Damian,
yes.
You are up.
Thank you, Governor. So phase 2, as the Governor said, is starting this coming Monday, June 15th. And the things that are changing in phase 2, or at least the headline things in phase 2 that are coming online, is an increase in the indoor occupancy limit. Currently in phase 1, it's at 30% of fire code occupancy. We're increasing that to 60% for all businesses that are now reopened, which will mean they can now put more customers in their stores. We're still maintaining the principles of social distancing in those places, but the upper cap is being lifted. The indoor gathering limit is being moved from 10 people to 50. This is for indoor events. Outdoor gatherings are at 250 people, and actually above 250 are still permitted to happen. They just require special approval, which folks have been seeking from both the Department of Education and the Division of Small Business. And then finally, as we move into phase 2, all Delaware families can now access childcare. Previously, parents had to be certified that they were not able to work from home before phase 1, that they were an employee of an essential business. As of June 15th, all Delaware parents can access childcare if they choose to do so. There are guidelines for childcare providers provided by the Office of Child Care Licensing so that they can do that safely.
And if I could, Damian, just to underscore a couple points there with respect to child care. You know, going back 3 months, there were a lot of child care facilities that were very concerned about the situation, rightly so, and were interested in closing their doors. And we struggled to encourage folks to stay open, because we knew that in order for essential businesses to operate and for employees to go to work, that they needed child care. As it turned out, we needed to designate essential child care centers for those essential employees. And folks need to understand, we made an investment in our workforce and in Delaware businesses by providing extra resources to the child care centers who did stay open. Those resources are reimbursable by the CARES Act. Thanks again to our congressional delegation, Senator Carper, Senator Coons, and Congresswoman Blunt Rochester. But we've been operating now for the last, almost 3 months, probably maybe not that long, but certainly close to that, with child care centers for essential employees. And now, of course, we're allowing and encouraging other child care centers that were closed to come back online so that folks can go back to work. But folks need to understand that we made an investment with taxpayer dollars so to support our workforce and to support our business establishments during this time when a lot of the child care centers were closed.
And just to underscore that point, I think when we did the town halls with business owners throughout the state and citizens throughout the state, access to childcare was one of the most frequent questions that came up as we enter these phased reopenings. Will they have access to that? Will their workers have access? And we understand the critical importance it plays as we get more of our workforce back to work. So there's a few other things changing in phase 2. It's around things that were not able to open in phase 1. Convention centers and meeting facilities can reopen following the indoor gathering guidance. Summer camps can reopen for children. Summer school and private instruction, which is something that we actually took an interim step to reopen, can now be open. And then finally, we're working on, and the governor talked about it in his opening remarks, and I think Dr. Rattay is going to talk about it a little more. We're working on a process for resuming competitive youth sports, respecting the sensitivities there. The Division of Small Business is providing resources along with the Division of Public Health as businesses reopen. Division of Public Health was very helpful in putting up signs that businesses can post and actually are required to post in their windows as they reopen. It was a question we got from many in the business community. Given all of the guidelines that were released in phase 1 and phase 2, they felt like it would be helpful to have some kind of way to message to their customers the rules that they had to be following. And so we provided this free of charge to businesses to post in their windows. And then the Division of Small Business has also been running a customer protection program. It's a voluntary program. We work with businesses to fill out a 10-item checklist, send it back to us, and if they certify that they're doing all 10 of these things, they get a window cling that lets their customers know that they have been abiding by the guidelines that we've set forward that were formulated in a way to protect workers and to protect customers. We've given out about 625 of these so far. It's been a popular program. I think we've gotten feedback from both customers and businesses that they've appreciated the window cling. So we're going to continue that program as we move into these later phases.
So Damian, again, thank you for the great work that you are doing and your team there at the Division of Small Business, working under the guidance of the Secretary of State, Jeff Bullock. And I would just go back to these resources for reopening that Damian talked about, because I see them in the stores as I circulate. It really does make a difference to reinforce the need to wear masks, to reinforce the need for social distancing. Most of the places, whether you go into the pharmacy or whatever, the grocery store, or to pick up takeout food, you can see the lines on the ground, and most places have plastic shields at the cash register as you cash out. But it's important to see these signs as well, and as you go to a restaurant. And I would encourage folks to go to restaurants so folks can get back on their feet, some of these businesses. But you need to see the layout that they have. They've been doing a really good job with all of that. And then, of course, the checklist of things that businesses are doing to meet the window cling and earn that kind of good housekeeping seal of approval. I think it's really important that we all lean into this together to respect the frontline workers who are there at the cash registers or in the grocery store. If you go through the assisted line, it's just important that they see a mask on you. You'll see a mask on them for sure, following these guidelines. And it's as we stop talking so much about positive cases and hopefully fatalities, we still need to be talking about protective measures because we know the virus is still with us. So Dr. Rattay, I know that one of the more difficult challenges that we've had is youth sports. God bless you for leading into it and helping us work through the guidance that we're working on now. And we all have an interest in doing this for our children, the health and vitality of the kids and the fun that they've been missing.
Great. Thank you so much, Governor. So as you saw from our numbers, we are doing well. We our epidemiological curve, if you will, shows that, we have less new cases, less hospitalizations, less COVID-like illness at this point, and that's great. However, today, in many ways, is a sobering day. Over 10,000 cases and over 400 deaths is, something that none of us have experienced before for an infectious disease in such a short amount of time, to see this many lives impacted. And so we also have seen other states, particularly in the South, and many who have done reopening and reopened sooner, who are seeing increases in cases. And so as we move forward, it's not surprising, right, that we have caution and that we're trying to balance the risks to move us back into our new normal while we're doing what we can to protect people. As the governor mentioned, I think all of us up here and many who are working on this, on the governor's team and on Damian's team and on the public health team, care very deeply about youth sports and the many benefits of sports, from the physical health, the mental health, the social health for kids, and just the community that is developed around youth sports. It's fun, and I think many of us miss it greatly, as I know many of our kids miss it greatly, and in many ways need to get out there and get back into their sports. And we so very much want our kids to get back out there. But as we've talked a lot about, this is a respiratory illness, and so the best ways to prevent the spread are going to be that social distance and the face covering. Well, with many youth sports, specifically those that are medium to low to medium to high contact, they, by nature, violate social distancing rules. To play the game, you are violating that 6 feet. And it's also not super comfortable, especially when individuals are exerting themselves physically, to wear a face covering. Additionally, when you bring large groups together, and we've talked about this before, it certainly makes, we call them super spreader events, but it increases your risk of spread to multiple people. And that also can be challenging to contact trace as well. So, some of our most popular sports include like lacrosse and soccer and field hockey, where some would say, well, what's the risk in that? But you have kids, running up and down the field, exerting themselves, breathing hard, and then fighting for the ball. And there is risk in that. The risk is decreased by being outside for sure. But, we are looking at especially those sports where there is a risk as it relates to social distancing, to find approaches to make it safer in our state. Now, there's a lot of sports where social distancing is not an issue. We're finishing up some guidance that we will be releasing in the next few days that'll be relevant for all sports, but we're also working on specific guidance for the most commonly played contact sports, in order to help people get back into them, like baseball and softball and lacrosse and soccer and field hockey and volleyball and flag football as examples. The ones you see here are the guidance around football, hockey, like ice hockey or roller hockey, rugby and wrestling will come later. Right now we're focused on those sports that are most commonly played right now in the summer, and we expect to have guidance on those sports by Friday, so that when phase 2 begins next week, the competition can begin. Assuming many sports are going to begin with intra-team scrimmages, but soon thereafter will be starting competition between 2 teams, which we know is a lot of fun for everyone. We also know tournaments, or also often called festivals, are also a lot of fun for everyone, for the players and the families. But there's also an increased risk when you have players who are playing multiple teams, multiple games in one day. Not only is there an increased infection risk, but also it's very challenging to contact trace. And then also with these events, there's a lot of socializing, often including, youth sharing rooms. And so we are working on this piece as well. We're targeting tournament play in partnership with those who host tournaments in phase 3. So we'll talk more about that in the upcoming days. So again, general rules as we think about youth sports, again, face covering wherever feasible, certainly for any coaches, officials, staff, spectators, families. Same with social distancing, 6 feet. It must be enforced, and I think many of us have already seen this week with some of our youth sports practices that that's not consistently always being abided by. So again, just a reminder, it's so important, as well as hand cleaning, hand sanitizing, and staying home when you're sick. So with that, I think I hand it back to the
Dr.
governor.
Rattay. Really some challenging exercise there in making sure that we can get youth sports right in a way that kind of makes sense, that manages the risk. We know the risk of exposure. Obviously, it's not something that's uppermost in the players and the kids' mind, their children's minds as they play softball, baseball, basketball, and start to think about some of the fall sports. But we really do have to lean into it, wrap our arms around it. I was joking the other day, I would have been a much better basketball player if I had a 6-foot cushion. I would have been able to make a lot more of those shots from the outside with that kind of a 6-foot distance buffer zone. But we, it's really important. It's important to our kids. It's important to parents and grandparents and to our community as well. So with that, I see Meredith. I want to thank again all the media outlets for coming once again and welcome your questions.
I'm curious, just looking back the last 3 months, is there any indication or evidence that, that the coronavirus might have been in Delaware before the March 11th case with the University of Delaware professor?
It's a great question, Meredith. I have no knowledge of people who had the COVID-like illness prior to that time. It certainly may have been here undetected. I think, we were looking closely at everyone from Asian countries, but as we learned later that a lot of the European travel into our nation was how much of the infection was spread. And we also really were looking at only people with symptoms. And so it is possible for sure that we missed asymptomatic people or people mildly ill. I don't think we missed any, I think it's unlikely we missed deaths because I think all of our hospitals were very tuned into looking for this illness, but we may have missed cases.
And we can bring the graph, the data dashboard up, and it shows you there, again, pretty straight line there on emergency level influenza-like illnesses, ILIs, and COVID-19-like illnesses. And you can see it's really very flat until it looks like just after March the 1st. So, I mean, at least the data doesn't suggest anything abnormal.
And in terms of reopening phases, how many will there be? And what can we expect from phase 3 or phase 4 and so on? Yeah,
so if you think back of where the phases came from in the first instance, they came through a document that was made available by the White House Task Force through the CDC. And it included these 3 phases with 14-day intervals in between, kind of to match the infection, period of time. It actually didn't give you a lot of extra time to react to seeing those, indications in the data. But there was some logic to all of that. We took that and adapted it to Delaware's situation, given kind of the limited and somewhat unstructured testing program that we had to determine when conditions were improving. And again, we looked mostly at the hospitalizations on a day-to-day and then a 3 or 5 day moving average. Because the testing was kind of so inconsistent, and more importantly, the results that we got, there was such a long lag time, that wasn't a good enough indicator for us. So going forward, we've always thought, and I've said to folks, so I think the 3-phase framework, we're just going to follow through with that and then make decisions going forward on that basis. We already have the committee chaired by the Lieutenant Governor and by Secretary Bullock looking at a resurgence in the fall. But remember, and I can't say this often enough, we're moving from a period of time where we're managing by statewide shutdown orders and stay-at-home orders to one where we're intensely so isolating the whole community. Now we're going to be intensely testing, identifying positive cases, and isolating those individuals, testing their contacts, same thing, and managing the spread on an individual basis. To my knowledge, it hasn't been done in our history, and so we're going to have to see how that works. I mean, you have to make contacts with the people who've been identified. They might already we're seeing, certain percentage of contacts you're able to make by telephone, by email, and the like, and we'll learn, I think, more as we move through it. But we're moving to a stage where we're managing by this testing, isolating, and contact tracing.
And just last question, is there a plan to reclose the state as science is indicating there could be another swing of this in the upcoming months? Is the
Yeah,
state
so again,
preparing?
I think that's one of the issues for the advisory committee to look at the resurgence. I mean, one of the big questions public health officials have raised is, what about the fall when you have the return of the flu and maybe a rebound of COVID-19? What do you do then? I think that broad tool of isolation, given the impact to date, has not as great a utility going forward. I think we need to manage it as we are with testing, isolating, and contact tracing, and we'll be ramping that up.
This question's from Doug Rainey at Delaware Business Now. Pennsylvania Governor Tom Wolf rolled out a business grant program yesterday, and Maryland Governor Larry Hogan announced something similar earlier. Does Delaware have a plan to do anything beyond the HELP program?
Yeah, so we'd like to fund the HELP program and potentially expand it with particular businesses. We had a question, I think in our last session or last week, about businesses that were negatively affected by some of the protests. And yeah, we'll be looking at all those things. I don't know, Damian, if I know we're probably oversubscribed with the budget that we have, or at least moving in that direction. And so we do need to look at ways that we can support small businesses. Damian?
Yeah, the governor said it well. We've had about 260 approved applications for HELP loans, distributed about $2.5 million, just first time to businesses. Several businesses have come forward now for second and third month loans. We're looking at the options we have to expand it to other industries. Right now it's for hospitality and cosmetology, but we know many of those other industries have been impacted by the shutdown. So we're hopeful that we can identify resources to do that. And if we can, we plan to launch a new program.
From Peter Osborne at Delaware Business Times, with many businesses feeling it's unfair to put limits on both social distancing and seating capacity, what are you saying to businesses that want you to expand the capacity limit to 100% in phase 2?
Yeah, we really just talk about the objective of social distancing and customer confidence and confidence more generally. We have made the opportunity available for restaurants to expand their outside dining footprint, which has really been I think very attractive to businesses. I talked to the mayor of Rehoboth on our call this morning, and he mentioned a number of businesses that were doing that. They're actually allowing them to go out into the street and use what otherwise would be parking spaces, and I've seen that work really effectively. We're look at every way that we can to help restaurants get back into business and to make the revenue they need to be successful. The 100%, the desire to go from, I guess, 60% to 100%, you know, it's hard to respond to that directly, knowing that there are other restrictions within a particular layout as to what effect that would have and what the effect is on outside, expanding the outside footprint. But I know Damian may have a response to this, that we've been working on that with folks. And again, the objective is simply trying to limit the number of folks in a gathering to prevent the spread of the virus.
And the only thing I would add is we've been, from the beginning, talking about a phased approach to reopening. It was the framework laid out by the CDC, and stepping up the fire code occupancy limits during each phase has been a big part of relaxing the restrictions as we move, and we're going to continue to look at opportunities to do so if it can be done safely.
From Melissa Steele at the Cape Gazette, why was the emergency order extended when the number of hospitalizations and critical patients continue to decline?
Yeah, well, the emergency order is, first of all, it has a duration of only 30 days. And so if there are provisions within the order that need to continue, for instance, the forbearance on those who can't pay their utility bills or their rent, the regulations around mask wearing and social distancing, all the things that we're just talking about in terms of business limitations and restrictions are in place because of are enabled by the emergency order. And so in order for us to provide for the protections necessary to manage the spread of the virus, we need to have those measures, and they otherwise wouldn't be possible to implement them. Presumably, you could have the legislature call back, but they have not been in session during this period of time. It wouldn't be, it doesn't lend itself to long, drawn-out committee meetings and discussion and debate, and so you need the powers of the executive order in order to keep in place some of those restrictions to prevent the spread of the virus.
Also from Melissa Steele, has there been any research on how sunlight and heat affect the spread of water droplets released when people speak, or whether COVID-19 has been spread outdoors?
I'm going to pass that to Dr. Rattay.
I'll take that one. So there has been some kind of experimental research looking at what impacts the droplets. And with experimental research, yes, sunlight can make a difference in especially aerosolized particles, so that they kind of drop down more quickly. What we know for sure is that, being outdoors is a much safer place to be. Aerosolized droplets, they don't survive and hang around very long outdoors. But that doesn't mean someone should spend time cooking in the sun if they may have been exposed. But the good thing is, that's why outdoor dining, for example, is a benefit for sure. Heat, I did want to make one mention, because I know there's been thinking that the infection would go away in the summer, and I think for us, we're very happy that we're seeing lower numbers now. But in some of the hotter states in the nation, they are on the rise right now. So it's not really clear that summer or hot months are making a big difference.
From Amy Cherry at WDEL, the World Health Organization and the CDC spread mixed messages about asymptomatic transmission of the virus. Which do you believe, and why?
Yeah, thank you. Really good question. Glad to have an opportunity to help kind of clarify that. WHO did come out yesterday and suggested from a very limited number of studies that asymptomatic spread may not be that common. They did come back out this morning and clarified and, in essence, retracted the statement that they made. I mean, the feeling that from a lot of researchers and CDC guidance suggests that asymptomatic spread is anywhere between 10 to 40% of the spread of the infection, which is, again, why face coverings for people without symptoms is important. The other thing with the WHO guidance is it didn't go into the difference between pre-symptomatic or asymptomatic spread. So many people, the 2 days before they become ill, are actually shedding a lot of virus. They just don't know it yet. So we should not in any way, shape, or form put our guard down based on what WHO came out with yesterday, and again, should continue to assume that we all are infected with the virus.
From Delaware Public Media, would you say the state's messaging on coronavirus precautions has been mixed in that it largely shut down the economy and all social interaction for months and is now encouraging large gatherings for protest? Would you say this has been unfair to Delawareans who may have lost their small business or were unable to attend the funeral of a loved one as a result?
So we had large gatherings protesting some of the shutdown orders where we respected the right of those individuals, the free speech rights of those individuals. They gathered without social distancing, mostly without masks, and didn't take any enforcement action because we understood that they were protesting the restrictions around COVID-19. And similarly, when protests came about in response to the murder of George Floyd in Minneapolis, we always reminded folks to, again, wear masks and try to attempt social distancing. The social distancing part did not happen, obviously, and mask wearing was mixed. I did hear from the mayor of Middletown this morning, who said that most of the folks at the gathering of several hundred in Middletown yesterday or on Sunday, most of the people were wearing masks. And so, no, I think our messaging has been consistent. We respect the right of First Amendment rights of all Delaware citizens, whether they're protesting against restrictions around COVID-19 pandemic or whether they're protesting police relationships with communities of color. And frankly, we'll continue to do that. We'll also remind them and encourage them to get tested if they were in that environment so that we don't have an outbreak. And we'll be looking over the next week or so, week to 2 weeks, about whether there are any increased number of cases that might have happened during that period of time.
From Paige Marley at WRDE, is there any plan or talk of reallocating funds from police departments in Delaware?
No, most of the talk about Delaware's budget is how are we going to maintain the levels of support for education, social services, healthcare, public safety services, law enforcement, correctional services, given the fact that we've lost hundreds of millions of dollars of revenue as the result of the COVID-19 pandemic. And so most of the conversations that I've had with lots of folks of good faith have been around police tactics and techniques around use of force with respect to use of body cameras among law enforcement agencies and all the kind of rules of engagement, if you will, and training of our law enforcement officers. But I think everybody in the community understands the importance of law enforcement to keep our community safe. I've lived in the city of Wilmington now for over 30 years, and what I hear mostly from my neighbors and in communities of color or not is the need to have community policing that are in our neighborhoods, that understand all of us and the problems that we encounter, but to help keep us safe. That nobody's been talking about reducing resources for law enforcement, and we're not thinking about it either.
From Amy Cherry at WDEL, as travel begins to resume and borders reopen, do you anticipate mandatory 14-day quarantines in Delaware upon return from international destinations?
Yeah, so that's not a question I've thought about. So,
No, I think we, in general, tend to look to the Centers for Disease Control and Prevention, who's really keeping a close eye on what's going on internationally and where the risks are. So at this point, there are not either additional, bans or quarantines expected, but it is possible that it could happen depending on level of infection in another country.
From Katie Tabling at Delaware Business Times, can you explain the process of selecting who will sit on the Pandemic Resurgence Committee among community and business leaders and healthcare officials?
yeah, so we have 3 subcommittees. The overall advisory committee was to be co-chaired by Lieutenant Governor Hull Long and Secretary Bullock. And then we looked for business community leaders to fill out the rosters of each of the subgroups, and took recommendations from Delaware State Chamber of Commerce, from labor organizations, from civic and organizations representing constituents, people of color for the equity subcommittee. We saw, and many of the inequities of our society here laid bare by the coronavirus here in Delaware, and we thought that was a really important. It is a part of each of the subgroups, but we decided to make it a separate subgroup in and of itself. So very similar to the way we would put together a task force legislatively or by executive order, allowing people to recommend folks to serve on each of the subgroups, and identifying people with expertise and knowledge that could represent and reflect the views of large constituencies that are important to the functioning of our state.
And this will be the final question from Peter Osborne at Delaware Business Times. How many of the 80,000 curative tests have you set aside for businesses to test their employees, aside from those mentioned for the poultry industry? Will they be charged for all or part of their tests?
Yeah, I'll start with the last part of it first, and that is we're trying to figure out an equitable, reasonable, and efficient way of charging for or paying for the COVID-19 tests that are administered. Many Delawareans have employer-provided health insurance. Their employers pay premiums for that. They ought to get some benefit from the premiums they pay, and part of that benefit, in my view, should be testing for a virus like this. Taking the information necessary to bill private insurance can be cumbersome in some of the venues we use, so that'll come into play. Many of the hospitals have both not billed at all, or in some of the community testing sites. They billed when folks were recommended by the primary care physicians, and then billed their insurance. And I know that happened because we had folks that were complaining about a copay, which wasn't supposed to be. So we've had a patchwork. Now we're going to try to figure out a rational way of funding the testing. We do have millions of dollars from the federal government to use for this purposes, and we will do so. We did test thousands of Sussex County and using public resources and the federal money. Newcastle County is using some of its federal money for that purpose. We will hopefully be able to reimburse the hospitals for some of their expenses, recognizing there certainly were gaps in funding for the testing that they did, and they were tremendous a partner with us for all of that. So we need to find an efficient and effective way of doing it, of charging it going forward, and then kind of reimbursing people looking backwards, and then what's the best way to get the most people tested and through. We also need to be working with businesses on their plans to test their employees, and again, work out some system, efficient and effective system for charging to that, whether we use our federal money or whether it's a cost share or whether they charge the insurance that they pay premium for on a monthly basis. And so that's a kind of complicated explanation for coming up with an efficient and effective way of paying for the testing that needs to be done from a public health perspective. So again, I want to thank everybody for joining us today. Recommend that folks go to our website at de.gov/coronavirus/healthy community. If you want to see our data dashboard, I would recommend that you look at that. You can see all the testing that's been done and who the tests have been administered to by county, by state representative district, state senate district, geographic area. You can look at all that. My message for the two challenges that we face, the social unrest around and the advocacy around improving relationships between communities of color and law enforcement, I say keep the faith. It's time to go to work and making changes that help folks have faith and confidence in our public employees and our law enforcement officers. And with respect to COVID-19, they say prevent the spread. You can do your part by, if you're sick, staying at home, by washing your hands frequently and sanitizing them. You'll see those sanitizing stations at all the businesses that you go to. By wearing a mask, respect your neighbor. Think about your neighbor by wearing a mask or face covering in public, and by respecting your neighbor and your friend by staying at least 6 feet apart. It's not time to be complacent. It's not time to say that to declare victory and move on. It's really time to lean into getting a real return on the tremendous cost that has been borne by the broader society and in particular by certain businesses and certain employees that weren't able to get income during the last several months. So let's take advantage of the good hard work that everybody has put into it over the last 3 or 4 months and continue to move forward. So thanks for joining us today.